It has been one of this nation's leading biomedical research facilities for more than 5 decades. The Los Angeles Biomedical Research Institute at Harbor UCLA Medical Center. And now, LA BioMed is attacking the new medical challenges of the 21st century. To do this, the Institute is expanding the platform of support it provides its talented researchers, freeing them to concentrate on their missions of discovery.
Essentially, they are bringing discoveries to life.
Discoveries that can improve the health of you and your family. Researchers at LA BioMed developed the modern cholesterol test, artificial lung fluids that save the lives of babies, stent technology to repair aneurysms.
We're working on prevention strategies for type 2 diabetes, which is a pandemic problem internationally.
And if you ever have to call the paramedics for your injured child, remember that the television show Emergency was based on real-life innovation that was done right here.
The summer of 1969, we began a pilot program here on the Harbor campus in which we trained paramedic trainees from both LA County and LA City fire departments, and that began the paramedic program as we know it today.
Now, LA BioMed is researching the nation's hospital emergency departments to see how they're prepared for pediatric patients.
And what we've found is that emergency departments have a long way to go to get better prepared to care for children.
Other LA BioMed researchers believe they've shown that a non-invasive heart scan can be nearly as effective as expensive and invasive angiograms in detecting clogged arteries, somewhat like we screen for breast cancer.
It's been proposed that the heart scan, a non-invasive CAT scan of the heart, can be used to identify early disease, and we've been trying to validate whether this is kind of the mammogram of the heart.
In all, 1,000 different research projects are in progress at LA BioMed.
I think our work in male contraceptive development has made us leaders throughout the world.
We develop treatments for a very rare genetic disease called MPS.
We are really interested in how to defend patients against infection and to turn discoveries in basic science into new medicines for the future.
There are literally thousands of people in America that die each year from staph and candida infections, and if this vaccine works, it would prevent many, many deaths.
The therapies I work on are called immunotherapies, and they're designed to boost your immune system to fight cancer once it's already spread.
But these researchers don't just work alone. By fostering collaboration among its researchers working in different fields, LA BioMed is paving the way for sweeping new discoveries. Investigators who specialize in areas such as kidney, heart, and diabetes are working together, and through their collaborations, a more complete picture is emerging of how the body works and how best to treat it.
I'm Juanita Gudis, and I'm here because I was diagnosed with sickle cell.
Sickle cell disease is a hereditary disease, most common among people of African origin. Throughout their life, they suffer painful episodes. This pain is compared to pain of cancer patients, except they say that it's much worse.
I suffered through pain crisis ever since I was 2, where I had to go to the hospital multiple times and stay there for long periods of time. And I missed out on a lot of my childhood. In fact, I don't really remember a lot of my childhood because most of it was in the hospital.
Dr. Yutaka Nihara has begun clinical trials at LA BioMed on using L-glutamine in an attempt to treat sickle cell.
And they told me about Dr. Nihara was conducting some research for sickle cell. And I was, oh my gosh, this is going to be great, finally a cure for my disease.
Our data is not so huge, but every patient that we have treated, we had wonderful results.
Amazingly, for the first time in her life, Juanita has been pain-free.
I would say about 2 years now. 2 years I've been pain-free, no hospital visits, no pain crisis, no even mild sicknesses where I'll catch a cold or something. None for 2 years.
But for them, not having to come to the emergency room or to be hospitalized because of pain, that's a real big deal.
Very happy, you know, to live a normal life without being in the hospital all the time, missing out on life experiences, and I'm just very happy to partake in this and be a pioneer.
Financially, I think we'll be able to save this country for treatment of sickle cell disease. We'll be able to save about $10,000 per patient per year.
During the time I was on glutamine, my health improved, so I started to think to myself, oh, well, you know, now I can actually look forward to going to prom and, wow, and doing stuff, you know, a normal American teenager would do. And that made me very excited, and wow.
If we can provide maybe 20 or 30,000 of these people better life, we'll be very happy, and we're hoping to achieve that.
But none of this research would be possible without LA BioMed, which searches out the grants, provides equipment, and handles the administration, freeing the researchers to do their important work.
If we don't have the infrastructure to provide what researchers need, there's going to be no research.
It's important to support LA BioMed because there is no source of money without raising either grant funds, going to the government, or to private donors. Everybody's reading the news, the government's basically out of these businesses.
The world has become infinitely smaller, more interconnected. From the threat of bioterrorism and environmental impacts on human health to the dangers of infectious diseases, global health concerns have emerged as a priority. LA BioMed investigators are taking on some of the most vexing of these global health challenges. Among them are HIV/AIDS, Candida, tuberculosis, and eye infections that blind thousands of children in developing countries each year.
LA BioMed is really a jewel here in the South Bay. It's a fantastic institution that has global impact, really. And so Toyota is proud to be a sponsor of LA BioMed because of the impact that it makes, not just in the local community, but all across the world. The science that is done there, the incredible dedication to the improvement of living conditions is really something that we want to support and see grow.
The place has changed the face of medical care in a variety of areas.
But the excitement is tomorrow. What we are discovering today will impact tomorrow in ways that we don't envision.
LA BioMed has changed my life tremendously. I'm a normal, healthy teenage girl rather than sitting in the hospital watching life go by.
Bring discoveries to life. Become part of the dream.